Benign prostatic hyperplasia. Can you naturally shrink the prostate? While there's no magic solution to shrink an enlarged prostate instantly, growing evidence suggests that natural remedies can serve as a helpful complement to conventional approaches for managing prostate enlargement and benign prostatic hyperplasia, BPH. Simple lifestyle adjustments, dietary choices, and specific exercises may contribute to improved prostate health and symptom management. We explore what BPH is, its development, and practical ways to manage it naturally. What is benign prostatic hyperplasia? Benign prostatic hyperplasia, BPH, is a common condition in which the prostate gland undergoes abnormal growth, known as hyperplasia, resulting in a greater than normal number of prostatic cells. This growth often occurs in the transition zone of the prostate, which surrounds the urethra. As a result, it can lead to urinary issues and, in severe cases, bladder obstruction. BPH is thought to be associated with age-related hormonal and immune imbalances. Understanding prostate enlargement in BPH. While people often use prostate enlargement and BPH interchangeably, there's a distinction. Prostate enlargement generally refers to individual prostate cells becoming swollen, while BPH involves an increase in the total number of prostate cells. Not all individuals with BPH experience prostate enlargement, and the condition can vary significantly in severity. Prevalence of BPH. BPH becomes increasingly common with age. Statistics show that more than 70% of men over 80 are affected by BPH, and around 30 to 40% of men in their 40s may have subclinical BPH. Genetic and environmental factors appear to play a role in BPH development, influencing how prevalent it is across different populations and cultures. Signs and symptoms of benign prostatic hyperplasia, BPH. BPH symptoms often overlap with those of lower urinary tract symptoms, LUTS, making them difficult to distinguish. Common signs of BPH include difficulty emptying the bladder. Men may experience interruptions, straining, irritation, and trouble initiating urination. Frequent and urgent need to urinate. This can be especially challenging during nighttime hours, disrupting sleep with frequent trips to the bathroom. Sensation of incomplete emptying. Many men feel as though their bladder isn't fully emptied even after urination. Incontinence. Loss of bladder control may also occur, leading to accidental leakage. Chronic UTIs. Urinary retention can make men more susceptible to urinary tract infections. Prostate tenderness. Discomfort or tenderness in the prostate area is another possible symptom. Dribbling at the end of urination. After finishing urination, some men experience dribbling or leakage. Blood in urine. Hematuria, or blood in the urine, may be present in certain cases. Additionally, BPH may lead to symptoms in other areas, such as increased anxiety, infection susceptibility, sensitivities, and erectile dysfunction. Symptom severity and progression. The severity of BPH symptoms varies widely among men, depending on the prostate's size and the specific way it becomes enlarged. Some men may notice little to no symptoms until the condition is advanced, while others experience symptoms early on that worsen gradually. Monitoring and addressing symptoms early can support better management of BPH and prevent more significant discomfort or complications as the condition progresses. Potential causes and mechanisms behind BPH. The development of benign prostatic hyperplasia, BPH, is influenced by several factors, including aging, hormonal imbalances, and immune function. Let's break down some of the primary drivers of BPH. 1. Aging and cellular senescence. Aging is widely regarded as the leading factor behind BPH, particularly in genetically predisposed men. As the body ages, cellular functions decline, leading to hormonal imbalances, reduced immune response, and metabolic changes. These age-related changes can contribute to chronic inflammation, higher infection risks, and impaired cellular repair, which collectively support the progression of BPH. 2. Hormonal imbalances. Low testosterone levels, along with changes in other key hormones, are often implicated in BPH. The prostate relies on stable testosterone levels to regulate cell growth and maintain healthy cellular turnover. When testosterone decreases, the body may overcompensate by producing growth-stimulating hormones, which can drive excessive prostate growth over time. Some specific hormonal imbalances linked to BPH include high DHT and 5-alpha reductase. Low testosterone often leads to elevated levels of dihydrotestosterone, DHT, a potent form of testosterone that stimulates prostate cell growth. The enzyme 5-alpha reductase, particularly its type 2 variant, is responsible for converting testosterone into DHT. Many BPH treatments target this enzyme to control DHT levels and prevent further prostate enlargement. High estradiol, E2, and aromatase. Activity. In response to increased DHT, the prostate may begin to use estradiol, E2, a potent estrogen, to inhibit growth. However, long-term estradiol elevation can desensitize estrogen receptors, impairing regulation and allowing unregulated prostate growth to resume. Estradiol also inhibits testosterone production, compounding hormonal imbalances. Dysregulation of the gonadal hypothalamic pituitary axis. This axis regulates testosterone production through signals between the brain and gonads. Excessive stress hormones, such as cortisol, and brain hormones can lower testosterone levels, while high DHT levels may also inhibit testosterone production. Correcting imbalances within this system is an essential focus in addressing BPH-related hormone disruption. 3. Immune system regulation. The immune system's response to age-related changes and chronic inflammation plays a role in BPH. Hormonal declines and immune shifts with age can lead to chronic urinary tract infections, UTIs, which are more likely to invade the prostate as BPH progresses. As prostate cells grow excessively, the immune system may attack faulty cells, potentially triggering autoimmunity against the prostate gland. This immune response can cause additional prostate swelling and inflammation, further exacerbating symptoms and impairing immune defenses. Risk factors for prostate enlargement in BPH. Several risk factors contribute to the likelihood of developing benign prostatic hyperplasia, BPH. Here's a closer look at some of the main contributors. 1. Allergy and autoimmunity. In BPH, immune system imbalance often trends toward an allergenic autoimmunity-prone profile. This is marked by higher levels of CD4+ lymphocytes in the prostate compared to CD8+ T lymphocytes, which typically help fight pathogens. Allergies and autoimmune conditions can worsen this immune imbalance, raising the risk of developing BPH later in life. 2. Metabolic and reproductive diseases. High insulin levels, common in metabolic disorders, can stimulate growth factors like insulin-like growth factor 1, IGF-1, and disrupt the balance of reproductive hormones, both of which are linked to an increased risk of BPH. Reproductive health is vital, as the testes produce most of the testosterone that regulates prostate size and function. Reproductive conditions that affect testosterone production may therefore increase the risk for BPH. 3. Genetic factors. Men with family members who have BPH are more likely to develop the condition themselves. Additionally, genetic predispositions associated with anxiety, stress, autoimmune tendencies, and vascular health may affect BPH severity. 4. Vitamin D status and sunlight exposure. Vitamin D3 plays a critical role in maintaining prostate health, with higher levels helping to regulate and maintain a smaller prostate. Sun exposure naturally supports the body's production of vitamin D3, and inadequate sunlight has been linked to a greater risk for prostate issues, including cancer. Low lifetime sun exposure may similarly be associated with a higher risk of developing BPH. 5. Cell phone radiation. Research has suggested that keeping a cell phone in the pant pocket over time could contribute to DNA damage, increase cancer risk, and lower male fertility, all of which may add to the risk of BPH. How to shrink your prostate naturally. Many men dealing with BPH or concerned about prostate health often ask about ways to treat or prevent an enlarged prostate. Fortunately, with some targeted lifestyle changes, natural approaches to managing prostate health are highly effective and offer a gentler option compared to conventional treatments, which may carry side effects. Surgery and medications are typically reserved for more severe cases of BPH, but even then, they are often combined with natural strategies to enhance results. Below are practical, natural methods that can help to prevent prostate enlargement and may even support reducing prostate size for those with BPH symptoms or urinary tract issues. Let's take a closer look at these natural approaches, which range from dietary adjustments to exercise routines, and see how they can make a positive difference in prostate health. Complementary, natural remedies for an enlarged prostate. Making certain dietary and lifestyle changes can help prevent prostate enlargement or potentially shrink the prostate naturally. Here are some effective natural remedies and dietary suggestions to consider. 1. Plant-based, whole food diet. A diet rich in plant-based, whole foods, such as the Mediterranean diet, is associated with lower rates of prostate enlargement and improved hormone regulation. Plant-based diets are high in antioxidants and low in processed foods, which may contribute to reduced inflammation and enhanced prostate health. Key foods to include: protein. Rich foods, grains, legumes, and moderate amounts of quality meat provide essential nutrients for overall health. Nuts and seeds, especially pumpkin seeds, which contain phytosterols, lignans, vitamin E, and minerals that may help regulate hormones and reduce prostate size. Fruits and vegetables, foods high in vitamins C and A, help lower inflammation and reduce infection risk. Probiotic foods, yogurt, kefir, and fermented vegetables enhance digestion and may reduce inflammation, promoting metabolic and immune health. 2. Anti-BPH foods and plant extracts. Certain foods and natural extracts can inhibit the conversion of testosterone into dihydrotestosterone, DHT, or estrogen, E2, potentially reducing BPH risk and symptoms. Isoflavones. Found in soy products and red clover, these anti-inflammatory compounds inhibit enzymes like 5-alpha reductase, which contributes to BPH. Isoflavones also bind to estrogen receptor beta, promoting prostate shrinkage without disrupting hormone balance. 5-alpha reductase. Inhibitors, nuts, seeds, certain fruits, vegetables, and oils like coconut and olive oil contain compounds that may inhibit this enzyme, preventing the conversion of testosterone to DHT, a hormone linked to prostate growth. Aromatase inhibitors. Foods rich in phytoestrogens and other nutrients, such as flax seeds, citrus, berries, ginger, and mushrooms, help reduce estrogen production, a process that otherwise can affect prostate size. 3. Natural UTI prevention. Vitamin C and cranberry or tart cherry concentrate are known for preventing urinary tract infections, UTIs, which can worsen BPH symptoms. Additionally, herbs like echinacea and olive leaf extract support immune health, reduce inflammation, and may prevent UTIs. 4. Stress-relieving botanicals. Managing stress is important for prostate health, as high stress can worsen BPH symptoms. Antioxidant-rich foods may reduce stress-related inflammation, while adaptogens like ashwagandha, holy basil, and rhodiola rosea can help further regulate stress. 5. Nutritional supplements for prostate health. Several vitamins and minerals support prostate health and may reduce symptoms of BPH. Vitamin D3 and K2. Studies suggest vitamin D3, up to 6,000 IU per day, can reduce prostate size, lower DHT levels, balance testosterone, and reduce inflammation. Vitamin K2 complements D3 by helping regulate its metabolism. Zinc. This mineral is vital for testosterone production, immune health, and preventing BPH. Zinc supplementation has been shown to reduce prostate size, but it should be balanced, as excessive zinc can increase DHT. Foods like meat, grains, and legumes naturally provide zinc. These dietary adjustments and supplements can be useful additions to a prostate-friendly lifestyle, helping regulate hormone balance, immune health, and inflammation for improved BPH management. Always consult a healthcare provider before starting new supplements or dietary changes, especially for those with pre-existing health conditions. Prostate exercises for improved bladder control and prostate health. Incorporating prostate exercises into your routine can help improve bladder control and potentially reduce symptoms of urinary incontinence, especially for men with prostate issues. Also known as pelvic floor exercises, or male Kegels, these exercises focus on strengthening the muscles around the bladder and prostate. Benefits of prostate exercises. While prostate exercises won't shrink the prostate or prevent BPH, they can play a crucial role in bladder control and quality of life for those with prostate enlargement, BPH, or post-prostate treatment. These exercises are particularly helpful in managing urinary incontinence and can also benefit men experiencing erectile dysfunction. Effective exercises for BPH relief. Double voiding. Double voiding involves urinating, waiting for a few moments, and then trying to urinate again. This technique helps to fully empty the bladder, potentially reducing the frequent urge to urinate and improving overall bladder function. Kegel exercises. Kegel exercises are simple yet effective pelvic floor exercises. To perform Kegels, start by identifying the muscles you'd use to stop urine flow. Tighten these muscles, hold for a few seconds, then release. Aim for about 10 repetitions 3 times a day to strengthen these muscles and improve bladder control. Breathing and muscle control. When practicing pelvic floor exercises, focus on breathing naturally. Contract the pelvic floor muscles during exhalation and relax during inhalation, ensuring that you're only working the pelvic floor muscles without involving the legs, buttocks, or abdomen. Regular physical activity. Staying active can help lower the risk of incontinence by about 25% and reduce symptoms in men prone to urinary issues. Activities like Tai Chi are beneficial for men over 60 with BPH. Studies show Tai Chi can reduce urinary tract symptoms by 31%, improve insulin levels, and even boost testosterone, but not DHT. A study showed notable improvements in men practicing Tai Chi for 1 hour, 3 times a week, over 12 weeks. Note: men with prostate enlargement should avoid activities that put pressure on the pelvic area, such as cycling, as it can aggravate symptoms. By incorporating these prostate-focused exercises, men with BPH can improve bladder control, reduce symptoms of incontinence, and boost overall pelvic health. Regular practice of these exercises, combined with physical activity like Tai Chi, can make a significant difference in managing BPH symptoms and supporting a healthy lifestyle. Conventional treatment options for an enlarged prostate. For men with significant BPH symptoms that don't improve with lifestyle changes, conventional treatments may offer relief. Here's a summary of the most commonly prescribed treatment options. 1. Ultrasound therapy. Ultrasound can effectively reduce prostate size and improve symptoms without the need for surgery. Clinics may recommend ultrasound over surgery because it's minimally invasive, often more affordable, and associated with better outcomes. When combined with lifestyle and dietary adjustments, ultrasound therapy may shrink the prostate and improve urinary symptoms. 2. Pharmaceuticals. 5-alpha reductase. Inhibitors, common medications such as finasteride and dutasteride, target the enzyme 5-alpha reductase. Dutasteride blocks both type 1 and type 2, slowing the conversion of testosterone to DHT and helping to reduce prostate size by up to 20%. Although effective, these drugs may cause sexual side effects, like reduced libido or erectile dysfunction. Alpha blockers. These medications like terazosin, Hytrin, and tamsulosin, Flomax, work by relaxing muscles in the prostate and bladder neck, easing urination. While they improve symptoms, they do not reduce the prostate's size. Terazosin is typically prescribed once daily, and the dose may be gradually increased. It can cause dizziness, lightheadedness, and weakness, especially when changing positions quickly, as it also lowers blood pressure. Tamsulosin is often preferred for patients with blood pressure concerns since it has minimal effect on blood pressure. Taken once daily after a meal, common side effects include dizziness, headaches, and potential ejaculation issues. Both alpha blockers can improve urine flow, relieve urinary symptoms, and enhance quality of life, though they won't shrink the prostate itself. 3. Surgical options. Transurethral. Resection of the prostate. TURP. TURP has been the gold standard for men with severe bladder obstruction due to prostate enlargement. However, newer, minimally invasive techniques like HOLEP, holmium laser enucleation, and rhizome, steam ablation, offer equal or better outcomes with fewer complications. Minimally invasive techniques. HOLEP uses a high-powered laser to remove excess prostate tissue. Rhizome uses steam therapy to ablate enlarged prostate tissue. Both methods provide effective symptom relief without requiring incisions, making recovery smoother. However, even after surgery, lower urinary tract symptoms may persist, so a diet that supports urinary health remains beneficial. Conventional treatments can provide significant relief, especially for those with severe BPH symptoms. Whether through medications or modern surgical techniques, these options help improve quality of life while still allowing for complementary lifestyle adjustments. Foods and diet to help manage BPH. Diet is a powerful tool in managing BPH symptoms. Certain foods can support prostate health, while others may worsen symptoms. Embracing a balanced diet focused on prostate-friendly foods can be a natural and complementary approach to conventional treatments. Foods to include in your diet. Fruits and vegetables. Antioxidant-rich produce helps reduce inflammation and oxidative stress. Tomatoes, which are high in lycopene, are particularly beneficial for prostate health. Other excellent choices include berries for their anti-inflammatory properties, leafy greens like spinach and kale, cruciferous vegetables such as broccoli and cauliflower, healthy fats. Omega-3 fatty acids have potent anti-inflammatory effects. Good sources of omega-3s include fatty fish like salmon, sardines, and mackerel, flax seeds and walnuts, nuts and seeds. Pumpkin seeds and Brazil nuts are rich in zinc, an essential mineral for prostate health. They also provide antioxidants and essential fatty acids that support overall wellness. Whole grains. Fiber-rich whole grains, such as oats, brown rice, and quinoa, help regulate hormones and improve overall health by supporting digestive health and maintaining balanced blood sugar levels. Legumes, beans, lentils, and soy products are excellent sources of plant-based protein and phytoestrogens, which may help balance hormone levels and reduce the progression of BPH. Herbs for prostate health. Certain herbs are known for their potential benefits in managing BPH. Saw palmetto may reduce prostate enlargement by inhibiting the conversion of testosterone. Nettle root supports urinary tract health, potentially easing urinary symptoms. Pygeum improves urinary flow and has anti-inflammatory effects. Foods to avoid. Red and processed meats. High intake of red and processed meats may increase prostate cancer risk and exacerbate BPH symptoms. Opt for lean proteins like poultry, fish, or plant-based protein sources. Dairy products. Some studies suggest a link between high dairy consumption and an elevated risk of BPH. Choosing alternatives like almond or soy milk might be beneficial. Caffeine and alcohol. Caffeine and alcohol can irritate the bladder, worsening urinary symptoms. Reducing or eliminating these from your diet can alleviate BPH-related discomfort. Sodium. Salt. High salt intake can increase blood pressure and inflammation, aggravating BPH symptoms. Avoid processed foods and opt for herbs and spices instead of salt for flavor. Sugary foods and drinks. Excess sugar can lead to weight gain and inflammation, potentially worsening BPH symptoms. Replacing sugary snacks and drinks with whole fruits can significantly improve health. Spicy and acidic foods. Foods that are spicy or highly acidic can irritate the bladder and prostate, worsening BPH symptoms. Limiting curries, chili peppers, and acidic foods may reduce discomfort. A diet tailored for prostate health can be a powerful ally in managing BPH symptoms. Integrating prostate-friendly foods while avoiding irritants may improve quality of life and support overall health. Lifestyle changes to help manage an enlarged prostate. Adopting some key lifestyle adjustments can significantly ease symptoms of BPH and improve daily comfort. Here are practical changes that can be integrated into your routine to reduce discomfort and enhance quality of life. 1. Reduce water intake at night. Limiting fluid consumption in the evening can reduce nighttime trips to the bathroom, a common challenge with BPH. By drinking most of your fluids earlier in the day and reducing intake a few hours before bedtime, you may enjoy better sleep quality and fewer disruptions during the night. 2. Urinate. Promptly when you feel the urge. Promptly responding to the need to urinate is essential. Holding urine for extended periods can put strain on the bladder and worsen symptoms. By urinating regularly and fully emptying your bladder each time, you can help minimize retention and reduce the risk of urinary tract infections. 3. Avoid antihistamines and decongestants. Certain medications, particularly antihistamines and decongestants, may aggravate BPH symptoms. These drugs can tighten muscles around the urethra, making it harder to urinate. If you're managing BPH, speak with your doctor before using these medications. They may suggest alternatives that won't interfere with prostate health. Implementing these small but effective lifestyle changes can make a noticeable difference in managing BPH symptoms, helping you feel more comfortable and in control of your daily routine. Frequently asked questions. How can I check for an enlarged prostate at home? While only a healthcare professional can provide a definitive diagnosis of an enlarged prostate, BPH, you can monitor certain signs at home that may indicate a problem. Watch for symptoms such as a weak urine stream or difficulty starting urination, frequent urination, particularly at night, nocturia, a sensation of incomplete bladder, emptying after urination, dribbling at the end of urination, If you observe these symptoms, it's essential to consult a doctor for a thorough evaluation. They can conduct specific tests to confirm whether BPH is the cause and recommend suitable treatment options if needed. How do I maintain prostate health? Maintaining prostate health largely comes down to a balanced lifestyle, nutritious diet, and regular preventive care. Here are key strategies to support prostate health. Eat antioxidant-rich foods. Incorporate more fruits and vegetables, especially those rich in antioxidants, such as tomatoes, high in lycopene, berries, and leafy greens. These help reduce inflammation, which can benefit the prostate. Stay hydrated. Drink plenty of water throughout the day to support urinary tract health. Limit fluids in the evening to reduce nighttime urination. Limit alcohol and caffeine. Both substances can irritate the bladder and increase urinary symptoms, so reducing intake may help manage discomfort. Avoid processed foods. Processed foods often contain high levels of salt, unhealthy fats, and sugars, which can contribute to inflammation and poor metabolic health. Consider natural supplements. Certain supplements, such as saw palmetto, green tea, and lycopene, are believed to support prostate health. Always consult a healthcare provider before adding new supplements to your routine. Exercise regularly. Physical activity is essential for overall health, including prostate health. Exercise helps maintain a healthy weight and reduces stress, which can positively impact the prostate. Monitor your health regularly. Routine checkups can help detect any prostate changes early on. Stay attuned to any urinary symptoms and discuss them with a healthcare provider if they arise. These steps can support a healthy prostate and are beneficial to overall health. As always, consult with a healthcare provider, especially before making significant changes to diet or lifestyle. Benign prostatic hyperplasia, BPH, is a non-cancerous enlargement of the prostate gland that can lead to urinary symptoms and bladder obstruction. While it predominantly affects older men, it can begin as early as ages 30-40. Early detection allows many individuals to manage BPH through lifestyle and dietary modifications aimed at correcting hormonal imbalances and reducing prostate size. Effective strategies include maintaining a healthy diet, engaging in regular physical activity, performing prostate exercises, and incorporating foods with anti-BPH properties. If these lifestyle changes are insufficient, medical interventions such as ultrasound therapy, pharmaceuticals, or surgery may be considered.